Welcome back to Studio 701. You most likely know when you're stressed, but how do you deal with that stress?
We're going to ask a naturopathic doctor who's from North Dakota. Joining us now is Shyla Shower. Thank you so much for being with us here today, Shyla.
Thank you so much for having me.
Okay, so first question we have, and you might get this a lot, is what is a naturopathic doctor?
Yeah, that's a great question. It's naturopathic doctor might be a new term for a lot of people. And what sort of sets it apart from more of the conventional medical doctor is our training's a little bit different. So how naturopathic doctors work is that you have your 4-year undergrad education where you study biochemistry, chemistry, and biology like you would for any other medical school. And then you apply for naturopathic medical school, which is a 4-year medical program where we study the basic science like you would in any other medical school. And then along with learning pharmacology and medications, we also learn about nutrition, lifestyle, herbs, and using supplements to treat certain conditions.
Okay. And Shyla, can you specifically tell us who should be going to a naturopath doctor and why should they choose that option?
Yeah, so in the state of North Dakota, we have a licensure. So there's 7 licensed naturopathic doctors. We're all throughout the state. We see a lot of patients who are interested in maybe alternatives to medication or maybe who are looking to just overall improve their health. I see a lot of clients and patients who maybe are not feeling the best. They're feeling fatigue, low energy, that stress component, sort of like a broad spectrum of symptoms, and all of their labs are looking normal. And we can sort of take a deeper dive and run some different labs and figure out what's going on and how to treat them in a different way outside of just a medication.
Now, learning a little bit about you, Shyla, it sounds like you really love to travel. In fact, we'd love if you'd share where you are right now. But you're actually from Jamestown, and you've lived everywhere from Portland to China to the Netherlands. Why is that something that is part of your life, and how are you still able to do telehealth services?
Yeah, so setting up my practice, I really wanted to make sure that I was being able to reach people from all across the globe, and especially too in North Dakota. My practice is set up in Jamestown, and I go in between here and Amsterdam in the Netherlands. And I wanted to make sure that people in rural communities had access to alternative medicines, and they didn't have to travel to bigger cities where naturopaths are in Bismarck or Fargo. So traveling has been something that's really important to me, and it's really helped develop how I look at medicine, and especially too with the cultural components of what we're seeing for disease and pathology in different regions. So I see people all over the globe, and I just learned so much about culture and disease through that.
Interesting. Shyla, I want to dive into an actual type of diagnosis here. So I know myself and probably many other people, we have stress in life. We have busy professional lives, our families and such. Can you give us some tools from a naturopath approach of how to deal with stress?
Yeah, I love this question. I've been doing a lot of talks on specifically burnout. And there's sort of different phases that I like to look at when I'm seeing these sort of blanket statements. Like I said, people who maybe are having fatigue, low energy, difficulty with losing weight, or maybe they're gaining weight or losing weight depending on their personality type. And so what I typically do is run a pretty thorough hormone panel to see how your hormones are being affected from that stress, because we're all different. And so the symptoms are going to manifest different for everyone. There's 4 foundations that are always going to be the same for any pathology, but especially with stress, is going to be that when you're eating, so making sure you're getting in good nutrition and you're eating at certain times of the day, making sure you're getting enough sleep, making sure you're doing some sort of movement or exercise, and then figuring out what you as a stress management tool. And then from some of your symptoms, I like to add some herbs that are designed specifically for supporting that stress pathway. And it works wonderful, especially just the time that we've been in more recently, I've been seeing a lot of different chronic things that have an underlying root in stress. And we're just, learning with new research that about 75 to 90% of all pathologies have some component of stress related to that. So if we're not addressing that underlying symptom, it's difficult to feel better.
Mm-hmm. And hearing some of what you're saying, there's no surprise that you're into yoga and have quite a bit of experience with that. Can you just tell us a little bit about your yoga experience?
Yeah, I've been doing yoga for about 20 years. I kind of got into it because I wanted a different type of exercise. From that, when I actually originally studied political science and was working on Capitol Hill for several years and had my own sort of health issues that rose up, and I started switching my diet and really got into yoga, and I was able to manage my blood pressure and some stress symptoms through that. And so it's just been a practice that I've consistently done for a long time because it's been so impactful for me in my own health.
Awesome. Well, Shyla, we so appreciate you coming on the show and introducing this approach to medicine to the people of North Dakota.
I have a question. What time is it in Amsterdam right now?
In Amsterdam, it is, I don't even know. I work so much off Central Time.
Oh.
I'm used to Central Time. But yeah, it's just about 4:30. So
okay. We just hope we
so
weren't up in the middle of the night or something.
No. Yeah. No, my entire practice, I work on Central Time.
Okay.
So
Very
I have
good.
a unique schedule with that.
Well, thank you so much for your time today, Shyla. And
yeah, thank you for having me.
if you have more information, you can reach Shyla at showernd.com or find @sustainable.medicine on social media. Her email is also listed on the screen, so make sure and check that out if you have questions. But keep it here. Coming up next, how would you like to spend a night at the races? We'll tell you all about